was once mental health care has become perverted into a large industrial complex that we now call mental health treatment. And the care isn't there anymore. Instead, there's a drive for profits, outcomes, quantitative accomplishments where somebody's inner world has somehow become measurable for insurance industries to dictate whether or not they want to keep paying whoever's providing services. In this industrial complex of mental health treatment, there are several fallacies, and among them are the ones that have to do with evidence-based practice. And I'm going to talk a lot about, over time, deconstructing multiple evidence-based practices, but in this particular instance, I just want to address cognitive behavioral therapy, CBT. I'd address the notion that it is actually quite harmful for people who are suffering with complex trauma. So some of the major impacts of complex trauma are that we lose a relationship with reality and that we can't really tell if our inner gut is reading the room right. We sort of have a complex relationship with truth, like we don't really know what feelings of ours can be trusted or not trusted, when we're safe, when we're not safe. And we also feel like probably we're affording a little bit too much grace to the people who have hurt us. And what cognitive behavioral therapy asks us to do is, one, disregard our feelings, which are things that we actually have already problematically lost touch with and deeply need to reconnect with. Two, to challenge our thoughts, which we're already doing obsessively because we lost contact with the certainty that we once had before the trauma happened to us. And it asks us to frequently question black and white thinking and pathologizes black and white thinking when it is actually black and white thinking that would allow us to set the boundaries we need with the people who have hurt us most. And the amount of gray thinking that we've allowed the people who have hurt us up until this point is only exposing us to more hurt. So when somebody says, here's CBT for complex trauma, just wonder if that's helping, harming, or telling somebody, well, to stop feeling exactly what they need to know about themselves.